I just heard something. Breaking news. You said Weird Al is going to be in New Mexico?
He is. He's got a concert in Santa Fe scheduled in another week or two, something like that.
Gosh, I'm going to have to look that up and see. Maybe I can go to that. That's one of the things I'd like to go to. There's something else I'd like to do, and my requirements are so limited, so basic, because I basically don't do anything except this. And I noticed the Model Railroad folks up in Roswell are asking for the public to come in and help run the trains during the fair, volunteer at the fair. And I've always had an interest in the model railroads and the trains. I don't have a set right now because we don't have enough room. I guess I could convert one room into a train room, but
Could.
Lana's going, no, you're not. But they're asking for volunteer. I'm really seriously thinking about volunteering, and but you got to go to a training day before the fair. But my schedule gets so weird. I never know from 1 minute to the next what I'm doing, and so maybe I just need to do that. Anyway, Kirk Irby is going to stick around for just a little bit. I've got one other topic we want to make sure that we cover, and then we've got our next guest going to be joining us here in just a few minutes. But one of the things you wanted to talk about, Kirk, was that some folks that are coming in for their, I guess for a prescription or something, your folks are having to ask a few more questions than maybe they had to ask before, that the patient or the customer had to answer before. Can you kind of tell us a little bit about what specifically has changed and what area you're having to...
And that has to do with what we call controlled substances, which is a legal definition that the DEA has. And a controlled substance is pretty much any medication that has the ability to be abused.
Okay.
And that gives, that classification gives DEA the ability to regulate that medication. And one of the things that they're doing in a effort to kind of try to curb the opiate epidemic, as we've kind of heard over the last couple of years, is that they are not doing it themselves, but they're kind of getting the wholesalers, the drug wholesalers, to look at the accounts that they have, and they're imposing buying limits on various categories of controlled substances. And those buying limits are based on pretty much your total prescription volume. And therefore, you get somebody who is filling their prescriptions at one pharmacy, they go to a second pharmacy to get a prescription that's nothing but a controlled substance, so something for pain. First of all, that's kind of a red flag, because the DEA looks at people that they are considering doctor shopping or pharmacy shopping, and that's going from one doctor to another doctor to another doctor, getting prescriptions for the same thing, and then going to different pharmacies and getting those filled, so that they're not getting, all three prescriptions filled for one drug at the same place. That is a red flag. But that kind of hopping around between pharmacies is also considered a red flag, and there may be a perfect legitimate reason for that. Like you always get your medications at one pharmacy, but now that pharmacy's closed or they're out of that medication, because we are having some supply chain issues as well. And so you've got to go to another pharmacy to get that filled. So that kind of entails us asking questions of, why are you here when you're not getting here your other prescriptions here? Or why are you all of a sudden getting this one prescription filled here when you have been getting it filled at another pharmacy? And that record, looking at that, kind of is what we have to do from our point of view, and we have to document why that patient is doing things outside of the norm. And that norm is being defined by the DEA and not by us, by the doctor, by the patient, that type of thing. So, and a pharmacy's ability to order and buy controlled substance inventory is based on their total purchases from a wholesaler. Therefore, it says a percentage. So if you get somebody who is coming to your store out of the blue and has a prescription from the emergency room for 12 or 15 tablets, it's usually not a problem. But if they're coming to you and they have a prescription for 60 or 90 of something that you've not been filling on a regular basis, that can cause a little bit of concern. So that's one of the reasons that if people are wanting to go to one pharmacy that's different from where they normally get, and they start getting all these questions, and they say, why am I getting all these questions? Or, why is, they're kind of acting like they don't want me here. And that's really not it. We're just trying to cover our own records so that if we do get a DEA agent looking at our records, that we have the appropriate documentation for that, of why somebody is here. And I had somebody a few days ago that normally was going to another pharmacy. That pharmacy was out of a medication. They came over to us, and I had to verify with a pharmacist from that pharmacy that yes, they were out of that medication and could not get it before I could fill it at my pharmacy. So there's just some extra, I don't want to necessarily say paperwork, because a lot of it's all done computerized, but
sure,
extra record keeping that we have to do. And we also have to make sure that we're not trying to order more than our limit, because that is also gets reported back to the DEA. So
yeah, well, it's a serious business, the opioid addiction specifically, and there's all kinds of things that are being done to try to manage manage that to where it's used properly, and that just shows you how powerful that type of drug is. And so you got to follow what the doctor says, and the doctor's got to be careful in how they prescribe it, and pharmacies have to be careful in making sure that the prescriptions that are filled are legitimate, and that the abuse isn't going on. It's really kind of amazing how they're trying to handle
it. It is. It's kind of to me kind of a sad situation that we're there, but we are there, and having to deal with these government regulations, and they're not out in the public. I mean, the DEA doesn't release these regulations so that everybody can know them. They just kind of have told drug wholesalers, this is what you've got to do. And then when we run up against a brick wall, we're saying, why?
Mm-hmm.
Where did this come from? And then it kind of gets explained to us where it came from, and it makes sense.
Right.
But we don't know that these roadblocks are out there until we hit one.
Yeah, and then you've got and the poor customer is sitting there wanting what's going on, what's the problem here? And
yes.
So that can be frustrating too. So, well, good. Well, folks have any questions about that, or the latest on the COVID vaccines and boosters and flu shots? Probably flu shot season.
Yes, we have flu shots in now. We've got them about 2 weeks ago, and we've done a few. Haven't done very many, but we have them. We're ready to go. And
there are no issues if they do come out. Well, you don't know because it hasn't come out yet. I was going to say the previous vaccine for COVID, there was no issue with getting the COVID vaccine or booster and the flu shot at the same time.
That's correct.
But we don't know on this next one, do we?
And again, we don't know because there's not anything been released. But I would suspect that is going to be similar.
Yeah. So let's hope so, because that that's one trip instead of two.
That is.
So, all right. Kirk, thank you as always. Appreciate you coming in. Have some breakfast from McDonald's.
Thank you.
And Kirk's at Lowell's Pharmacy here in Artesia. We're going to take a break.